introduced Kazuko, and we're modifying our area where she's presenting because of technical cord difficulties. So hopefully that's okay, and it's a little more intimate up here anyways. So we'll go ahead and get you started. Okay, Kazuko.
Thank you, Tammy, and sorry for the inconvenience of the time. Happened to be the code issues, the Hyatt provided that code had some issues. Okay, so care clinics like to do lots of activities. My name is Kazuko. I'm a founder of the care clinics, and I have a 13-year-old child with autism. He's 13 right now. When he was 2, I took him to UCSF. Dr. Siegel told me to send him to the institution. Then I didn't. Nobody does. I mean, you know, we are strong mothers, and we don't do that kind of things. We're trying to run what we can do, what is opportunity, and, you know, start from there. How many mothers and parents, fathers? Okay, great. So this around here is our parents. I like to know about it. What I like to do is helping parents. And I like to give you lots of information when I learn about it, and so you can make informed decision. You don't have to feel like you have only one options, 2 options. You have lots of options. You can do lots of things, so you can make informed decisions. Okay, we take major PPO insurance, and we are not trying to make your daughter and son better. Not just that, we're looking into recovery, looking for recovery, okay? And how we do it, we're going to skip this because this is not Care Clinics conference. Autism today is still fitting into psychiatric file. When you study about the ICD-9 codes and CTP-9 codes and all codes, autism is still in the psychiatric pages. You know, there's this thick books you can study, and the autism is 299, still sit in the psychiatric coding area. And, you know, I don't know, our children, I like to share with you, I got the phone call from one of the mother crying 2007, January 15th, 2007. And she was crying because of her son went to emergency room for his just stomach pain, lots of stomach pain. So she didn't know what to do, so she took him to emergency room. And the emergency doctor says autism label on the paperwork. Then they didn't do anything, and they sent him home. Because he was banging his head to the wall, you know, maybe he had a huge pain. So mother saying, Kazuko, I wish my son had cancer. And I said, why you say that? Because she said, in that case, the hospital will put the red carpet on him. And I thought that is very sad. Why that things are happening? I don't like to say medical neglect, but our children are not unserved. You know, our children doesn't fit in the medical field right now, at this moment, if you code it 299, if you use 299. My son doesn't fit in anywhere. You know, we have to figure it out. Why? And we paid lots of money to the insurance company. I paid, my primary is $2,800 a month. United Healthcare, and you know, if they don't pay, there's something wrong. Because of my son has autism. Well, he doesn't have autism anymore, but he still has something. Okay? So autism is a multifactorial biomedical disorder with psychiatric symptoms. There's a lot of psychiatric symptoms, but where they comes from. Okay, this is our methodology, but I skipped this. We do ADIR, ADOS screening now, so we can say where they are when they start treating. And we're talking about psychiatric symptoms. Where are they coming from? We're doing a study. Tammy introduced me 15 minutes ago, talking about we do lots of research. We are trying to figure it out, where those psychiatric, disorder coming from. And we're starting to figure it out lots of things. And we don't want to announce it yet because it's not, the research is not finished yet. But we have a great ideas already, all right? Especially Lyme, of course, and HHV6, giving a lot of psychiatric symptoms because of HHV is sitting in a brain area, and the 6-year-old boy, first time they come over to our clinic and say, shoot me, kill me, whatever, they shouting at the blood draw room, in a blood draw room, and we figured out lots of high HHV6 titers. I'm sure Dr. Nicholson talked about this already, about HHV6. HHV6 is amazing. It's a significant number of children has high titers. And so is Lyme too. Lyme, I like you to know, Lyme doesn't show up in the beginning. I'm sure everybody talked about this already. Lyme it's hiding. They're very clever. It's in a B cell, and we're going to talk about that later. But so I just like you to remember psychiatric behavior comes from biomedical roots. There is biomedical roots, okay? Especially if you have a HHV6, high titers, you really have to treat yeast because yeast could reactivate HHV6. And the arginine also reactivate HHV6, okay? So you really have to be careful. Check all your children's, biomarkers and understand, how to control those infections, okay? Learning disorders. Lots of learning disorders also comes from heavy metals, okay? And everybody already know about this. Heavy metals and the infections binds together, right? So you're treating one thing's chelation. It's my son is, not doing very well because you are not taking care of infections, okay? And mood swing with lots of heavy metals and amino acids imbalances. Everybody comes in, and lots of kids has amino acids deficiency. So autism, we like to think only one piece gonna fit, and you're looking for one piece of a puzzle. But unfortunately, I'm not finding that. I'm finding more like a bunch of pieces are missing. So autism is much more complicated than everybody thinks. Look at these pictures. I kind of made it. Lots of genetic, predispositions and environmental factors. And Dr. Klinghardt, I believe he is speaking on Sunday. Yes? Sunday morning? Yes, he talks about this a lot. And basically, there's a lot of neurotoxins, Heavy metals are only one of them. And when you think about neurotoxins, people usually only think about heavy metals. And I'd like you to remember there's other things or neurotoxins as well. So when you remove neurotoxins each by each, children get better. That's what we do at the clinic. Heavy metals, and another thing I'd like you to remember is not just mercury. I'm sure everybody knows by now. Uranium is equally bad as mercury. Lead, lots of lead in our kids. Arsenic, tin, cadmium, aluminum, and lots of other things. Okay, so when you do the urine toxic metals, I'm sure some doctor talked about it this morning, but when you do the urine toxic metals, and you see nothing, not much, it's all green, and and when you take this to some doctors doesn't understand how to measure heavy metals, and they say, okay, your son, he doesn't have any heavy metals. But look at this after IB challenge, and showing lots of lead and mercury and other things. And how about if this 7 years old came into the clinic, it's already showing mercury. This is lead. It's showing the lead already, and after the challenge, it's 190. So you have to compare pre and post always to see how much after provocative testing and how much metals comes out. You have to always do pre and post and compare together. That's my recommendation. And the stool, sometimes it's go to the stool, and sometimes urine doesn't show up anything. It doesn't mean, we are only measuring so little portion. You never know, might go out through the skin. You never know, so you don't discourage about the one test result, okay? Because of stool, look at this, all right? This is actually my son. See, this is my son. James was 11, and this is pre. It's nothing show up. Do you know what this mean? Any parents? What does this mean? Exactly, stuck in the body. He's a non-excreter. He's a difficult child, and he can't excrete anything by himself. Okay, so this is the first IV chelation he done. First time he showed lots of, to us was a lot, compared to here, this to this. Oops. It's a lot different, so this much amount, say here to here, if we don't have any provoking agent, he can't excrete. So he's, storing in his body, all right? So that, and this one is mercury showed up in the fecal. And this one, some child has high aluminum. The Dr. Yasko talk about aluminum. HPHPA binds to aluminum. So if you have a Clostridium bacteria, and it's hanging to aluminum, so you have a lot of aluminum, installed in your body. By the way, HPHPA is a Clostridium bacteria. So this one, this time, after a year and a half, we keep doing IV every other week, my son James, and the first time he shows 45 mercury. That was my Christmas present from my son James, because it showed lots of mercury. So this time I was very happy, And funny things is more mercury showed up and symptoms get better. Isn't that funny? Well, that makes sense because you put in more mercury and his symptoms gets better. So even first couple times, first year, doesn't show much mercury, it doesn't mean your son doesn't have mercury. It's just taking time. All right? And molecular-wise, mercury, it's lead and other things comes out first. And the mercury could be the last. So I'd like you to remember that, okay? And so where those heavy metals coming from? And I don't want it to be blamed, but looks like mother's health, it become important. Like a pregnancy time, lots of our patients has, organ shots, has child with autism, and eating fish. Of course, I ate tuna fish every day, I'm from Japan, and I used to eat sushi every day, tuna, I love it. I used to love it. I stopped eating it. For me to stop tuna fish, it's a lot. And I completely stopped. Because I show you why. Some test results, I show you why I stopped. But there's a lot of, environmental factors I'd like you to think about. How many mothers has dental amalgam still? Just one? There you go. So you don't have any. This is the first crowd. Nobody has dental amalgam. So you removed all, or you? Wow, educated. That's you don't have anything? For sure? Okay. Okay. And also genetic predispositions. If your child is biological child, you have to remember, your child came from you, right? So do you know what that means? You have a genetic predispositions. Who is this? 72 mercury. It's me. I had 72 mercury. This is the second time I did IB challenge. So I highly recommend mother to be tested as well. Because we have same genetic predispositions. We install lots of heavy metals. Brain and kidney, liver and skin and jaw, everywhere. And if you have symptoms already, you definitely check your, biomarkers. So mercury, I did a lot of, IB challenge and I get down, and it's kind of got down. It's a good, not much. It's 10 and 20. But I removed the dental amalgams like everybody did. Here, 1, 2, 3, 4. I removed the dental amalgams, and it shows 41 mercury, 22 got down, but I did it again, and 36, 39, 36. This is, by the way, mercury amount, and each time I'm showing you how much mercury came out. Even I went to the environmental dentist. Did you go to environmental dentist? Yeah, her, she, you? Did you? No? You remove 4. No? She said finding an environmental dentist is another job, it's another subject. It's so hard to find, yes. After the birth, now it's after the birth. Vaccinations and all kind of things. Now I have to put a toy. So many things our children has environmental threat, and they don't have a good genetic predispositions. So okay, non-excluders. What is non-excluders? Do you know? Yeah, installed in the body and yes, can't get out. Right, and we have to think about why. I heard about when I go to conferences and doctors saying they are non-excluder, and what does that mean really, And I thought about, then I studied about it. Then there's a detoxification systems. There's a phase 1 and phase 2. Okay, then say this is a phase 1 sink and a phase 2 sink. If you don't have any issues, detoxification issues, the water goes out and out and out, just like that. Say this is a heavy metals, okay? So if normal development children, it probably doesn't have huge issues right there. However, if phase 1 is blocked, what's going to happen? Yeah, and even phase 2 is blocked. What's going to happen? So what happened is, I forgot to put another slide, but water is gonna go overflow because of it doesn't go in a drain. So do you know what this means? Like here, water overflow, cold. Right, it's oxidative stress. So this is oxidative stress going the water overflow. That's oxidative stress. Okay, so our kids has lots of oxidative stress because of that's the one of the reason. When you see the phase 2, look at this, cysteine and sulfate is extremely low. This is a typical case of our patient. We have over 2,000 patients right now, and this is a typical case. Phase 2 is blocked, phase 1 is blocked, so they can remove heavy metals, and also amino acids. Totally depleted amino acids. The one of the mother showed this to her pediatrician, and the pediatrician said, if this is a true story, he's not alive. Wait a minute. So this is a severe, you can tell it's very severe. And the mother started crying, I feed him good, and it's not that. I just let you know, even you feeding them good, eating lots of meat and everything, they still depleted. Okay, so it's nothing to do with you guys. I just like you to remember that. Okay, and also minerals. They are depleted minerals. And selenium and borons and zinc, usually high copper, low zinc, imbalances and deficiency. So just fixing all these things, children get better. And another thing to add is they are extremely low in lithium. Their lithium level is extremely low. So you can use lithium as just not the, like a psychiatrist use like a 300 milligrams 3 times a day or something. But we can use lithium for little dose. I'm not a doctor, so I don't know how to, how much or anything like that. But, you can do small dose for the mineral deficiency. As a mineral deficiency, and their mood swing even get a little better, You can try that with your doctor's recommend. You have to consult with your doctor always. Or you can come to the care clinics. Okay. Number 2, biotoxins. These ones, I'm sure some doctor talked about it. And lavanose is always high. Lavanose is yeast you don't want to have. And HPHPA is Clostridium bacteria. Okay. And sometimes when you treat just the yeast, Clostridium always goes up. So what happens is, do you know Carnival's golfer game? If you hit this one and something else pops up, so you keep pumping, You keep doing that. And we stopped doing a golfer game now. we know if you treat this one, we know already which one's going to pop up. So we treat together. Okay, so you can always discuss with your pediatrician. Okay, I'm going to talk about this. We started using infection panel. Actually, this was recommended from one of the doctor. And look at this, infections. Has anybody did this test before? Yes? How's yours? Your HHV6. How much? Powerful. 11? That's the usual number for our kids. 12? I don't know if I can say that. You can ask me later. It's parvovirus, EVV, That is human herpesvirus 6 over there, and parvovirus, VZV, and, like aspergillus. Aspergillus is more in the lung. Is anybody has aspergillus? My son has aspergillus, and I have aspergillus. You do too? Pardon me? I guess it's MD Lab in New Jersey, and you can test it, send it, and you can see the titers. And this child is 15.04. And the HPHPA virus, if you treat, their behavior get much better. Much, much better. You treating HPHPA, your son? Are you? Oh, I'm sorry. You don't have to. Okay. All right. So lots of, actually this one is CDC equivocal of Lyme, and lots of results we do. Okay, we have. And when you start treating, just let you know, IgG titers goes higher once. And you think it's not working, but actually it's working. All right. When always IgG titers goes higher. Your kids went higher? What is it? Oh, you haven't retested yet? Okay. If you retest it, we test lots of testing. We do lots of testing, so we know she's nodding because we do so much testing, and her children comes to our clinic, and we just do tremendous amount of testing because we can show to insurance company, we can show to, that's a great data, Then now we know before you get better, IgG titers, antibodies goes even higher before it goes down. Okay, so HPHPA, after the chelation, IV chelation, have you seen this ring around the mouth? Anybody? That's HPHPA, and lots of lashes, okay, CMV, and my son had lots of rashes one time. It's from ZVZ, and lots of things. I just don't know how much to say about the infections. If your son has Lyme, how many Lyme positive here? Lots of. And if your son or daughter has Lyme positive, your children will have lots of other infections, not just Lyme. So I'd like you to remember that, unfortunately, they're going to have everything, And this boy is our patient, one of our patients, and after we did treatment, this rashes shows up. Okay? And this boy has parvo, HPHPA, and EBV, and Lyme. Okay? And this is a parvovirus symptoms, and all those. And I'm going to talk about why it's like, one more thing is see, 2,660. This is HPHPA. This is LabCorp. I just wanted to show you, we don't use just the one testing company. We tested by 3-4 different companies because we like to make sure everything comes up high. And this is one of the case. VitalCore, we use VitalCore 2 for HPHPA. Is PCR is even detected. So you can see we can do lots of testing. And another thing is PANDAS. You know about PANDAS, right? You tested your children PANDAS already? No? It's a good idea to try. Lots of strep. This is my son actually. Look at this titers. Very high. And he does treatment. You can ask your doctors what to do for penicillin shots or IV or whatever. I I talked to Dr. Kakiya-san. I did the IM shots for my son. I do that every other month, and it works very well. Very good. And, pardon me? Mm-hmm. Yeah, and yeah, we did the strep for your children too. Okay. So this, again, remember, IgG titers goes higher, okay, when you treat. And I'm sure people talked about Lyme already, about the symptoms, okay, autism. What I like to talk about is effective treatment for Lyme. Everybody did everything yet? You know? Ozone, we use Ozone as a research project. UV, IVIZ, steam ozone sauna, infrared sauna, HPAD, IV vitamin C, IV antibiotics. The only things we didn't really see good results is at the care clinics is not IV antibiotics. But only treatment wasn't really good, effective for our children at the care clinics was IV antibiotics. Everything else worked very well. But doesn't mean it doesn't work for your son, okay? And the PK, we just started it. Combinations, ozone treatment, we do that at research use only, okay? 10 minutes. We like to discuss about, this is my son, CDC positive. Okay, genetic predispositions, that's what I want to talk about. Why our children get so many infections and others doesn't. Do you ever thought about it? Okay. This is your genetics, and this is your environment. Your SNPs is not your fate. You know, your SNP doesn't create disease. However, your SNPs and the environment, like here, is the disease and autism and cancer and chronic fatigue and all those kind of things. So your friend has drink and smoke and doesn't sleep middle of, nighttime, and she is very healthy and she doesn't have any issues. You have a friend like that? I do too. And I'm not like that. I don't drink, I don't smoke, I don't do anything, but even eating just tiny fish makes me sick. It's not fair. But that's that's the way it is, and we have to remember that. Just like you're driving your car, you remember, oh, I have to change the radiator, I have to change the oil. You're starting to know your car very well. And that same things you have to start knowing your body, You already know that probably. But testing this genetic polymorphism even gives you better ideas. Okay, here's the things. If normal kids, I say normal kids, I shouldn't say normal kids. Say normal, the people doesn't have a gene variations. Environmental issues, whatever, it doesn't matter. But if you have a little issues and huge issues, it changes like that. Mutations. Dr. Yasko talked about this a lot. And, okay, we're going to talk about CRMT. How many people have CRMT++? 2? It's a tough gene to have, You really have to be careful about that. You can do a lot because of that you have a CRMT++. You can do lots of things, B12, GABA, and lots of things. Here's my son. Here, CRMT. Mother is minus, and father is plus. If you have a plus, you have to really careful about alcohol. easier to get alcoholic, addictions, ADHD, bipolar. It comes from this genetics. It's predisposed to the issues. Okay, and a lot of our kids has plus. So we have to be careful about. It doesn't mean, and a father, James's father is a Harvard graduate and everything. It's not saying you're going to become autistic or anything like that. But they have, predisposition to it. Okay? So James, of course, it's plus minus because of mother is minus and father is plus. And the glutathione conjugation. This is another huge factor. Okay, glutathione conjugation, NULL, me and the father has nothing. No issues. And I figured out James is NULL, so he doesn't have glutathione gene in the kidney liver. So probably father had a plus minus. And I'm plus, so James is got a 1 plus from me and a 1 plus from father. And that means he is missing one gene in the creating glutathione in the kidney liver. So how he's going to detox? It's more difficult, more challenging to detox in the kidney liver. So he doesn't have it. So he has both mother and father contributed his genetic predispositions. Okay? So definitely combination. So we don't have to fight, you guys don't fight. It's your fault, and it's, combination, always. So that kind of things. And we have a lot of testing. And unfortunately, children has Lyme, doesn't have almost 100%. So far, 100%. They don't have a glutathione conjugation gene. It's always, they're missing, NULL. If children has Lyme, so we do megadose. Our doctor like to do megadose glutathione IV. Okay, you can do lots of things. But you have to be careful about oral glutathione because it creates yeast. Do you know? Glutathione creates yeast. So you really want to be careful about B6 as well. Creates yeast overgrowth. So you have to be, if you start taking oral, B12, B6 or glutathione, you always have to check with your Lavanos level. Otherwise, your child is going to be jumpy and you're going to get the letter from the school. Yes? Well, you kind of have, you can, okay? MTHFR, everybody talked about MTHFR, then conference everywhere, but we didn't really see significant numbers of MTHFR issues at our clinics. We did over 1,000 testing, but James is a plus. APOE, the one of the father, this is my son, MTHFR plus. Father is a plus, I'm plus minus 3. So James got the 1 from me and the 1 from him. Unlucky, James has everything. We are talking about methylation, okay? So active folate, you can do lots of things. So knowing your child's predispositions helps because you can do lots of things, lots of therapies, knowing, your child's predispositions. So you can do right, treatment or right to take a light supplements. You don't have to take, things unnecessary. SOD2, oxidative stress, IL-1 beta. This is an immune genes. Look at James, his plus. Father has plus. He had a 1 from the father, 1 from the mother. Again, it's very unlucky. It's just he has lots of chronic inflammation. This is another factor our kids has the issues right there. Okay, so you can do fish oil. Then recommendation is 400 or 800 fish oil. That's what they usually recommend, right? 2 minutes. And we usually give 5,000 fish oils. Okay, so you have to kind of think about what kind of, issues you have, and you might take in light supplements. However, the dosage might need to be adjusted. Okay, CVS. You don't have to be discouraged because you have a CVS issues. You can still use DMPS. My son is CVS++. And you don't have to walk away from DMPS because my son is CVS++. He has no issues. So, we can discuss about that, but they are talking about, I have only 2 minutes. In SAMe deficiency, everybody tested homocysteine level, and if you have a homocysteine lower than 3 or even 4, you have SAMe deficiency. Everybody know about SAMe, right? SAMe is better supplements than Litrin or Prozac. Even FDA says that. SAMe is very good. But you have to check your homocysteine level always. Okay, so you can talk to a doctor about that. But SAMe is really good supplements you can use, but always check with homocysteine level first. And these kind of other SNPs, I spelled wrong. It doesn't need an I over there. Okay, so summary is impaired detoxifications, impaired brain chemistry. So you can do, we boost the immune system. I finally, starting to understand boosting immune system. Actually, Dr. Nicholson told me 5 years ago already. Boosting immune system is really important, very important, okay? So try to not to add any more neurotoxins to your child because now they can't excrete, they have a poor methylation, so when it's coming in, it's hard to get out. So you can do is please do not add any more neurotoxin to your child's body. So we tell patients, parents, please, be careful in a home. Please don't do anything. Check your dishwasher if it's green or, orange or blue, something in there, dyes and those, and you guys can use it because our children can tolerate those kind of dyes and colors, okay? So that's our job to remove neurotoxins, all right? Then what we understand is single approach never help. Just doing chelation 5 years or just doing hyperbaric for 20 times or, it looks like what I find out, what we finding is you need a holistic approach. Holistic approach. Okay, so I'm going to skip all this. So start biomarkers, okay, treat everything, personalized, try to make a personalized treatment because of your children's, everybody's different. If you have 20 children here, everyone's different. Some of them have CMT, some of them doesn't have MTHFR. It's all different. So why are we going to fit in a, one, that like a cookie cutters approach? We can't do that. I bought one time I went to Dane conference and they're talking about cod liver oil, so I bought 5 cases. And I thought it helps my son, and I find out you can't take that much fish oils if you have some SNPs, and you can't take that. And number 2, and James has allergic to cat, he was allergic to cat. So that kind of things, you really need to find out your children's, issues, and you have to pick your supplements, and all kind of things. Okay, so what I'm talking about is from nice to do to have to do it, right? Is that kind of, see the difference? You know, everybody says, oh, it's good to have a glutathione orally 800 milligrams. And, you know, we like to know what I have to do it. What I have to do for my son. I don't want to waste $2,000 of supplements for nice to do. No, I don't want to do that. I just want to know only things I have to do it. You know, that kind of makes sense. So treatment plan is metabolic. It's enhancement, repair chemical imbalances and chelations, heavy metals detoxification, and the infection detoxification, immune boost, repair cells, oxidative therapies, and metabolic therapies. And I really encourage you to ask your children to do more exercise. Exercise equals 1 hyperbaric 90 minutes. Exercise. You know, of course, hyperbaric is really good. We do hyperbaric. My son does hyperbaric, but you really want to think about, you know, again, about how much you learn and, you know, feel when you're a child. So maybe that's why I don't have autism. You know, you know, exercise and sweating, it's very important. I'd like you to study about that, you know. It's exercise is very important. And the immune boost is very important. Because you can take so much in, you know, probiotics, and probiotics you can take a lot. We give out 500 billion per patient now, because we push, you know, the good bacteria push the bad bacteria. But, you know, antibiotics, how much you can take? You can take much. So ending up you boosting immune system can become very important. And this is our children. See, this is his line over there. And one child's, you know, mother together and reading a book, or I guess doing a computer. So everybody, you can find out some way to do the treatment, you know. And it took me 2 years to do IV treatment for my son. So I understand if you feel like how I do this, you know. I understand how you feel. Okay, and lots of treatment. We do, this is my son, with Dr. Kakias, this is an ozone treatment. I wanted to talk about ozone, but I'm gonna skip it. But since this is a steam ozone sauna, we do infrared sauna. HVAC is very good, RNA, all those. Oh, oops. Not this one. Oh, that was it. Okay, I was gonna tell you one thing. When you start treating, there's a Herxheimer reactions, you know, die-off reactions, and I like you to remember that. That could be fevers and shiverings and vomiting, and those kind of things that happens. And we call it die-off reactions, and it's a technical words is a Herxheimer reactions. And that things that we can't go without it. Especially children has Lyme, you know, it always has Herxheimer reactions. So you kind of have to find a good doctor, understand the issues, and discuss about it, how to minimize the reactions, and taking like a cholera type of, you know, supplements before you do IV treatment, and those kind of things become very important factors of your children's treatment. Thank you so much.